We're going to talk about Chapter 11, Special Senses, which are the eyes and the ears. You can see the related combining forms for the chapter. Eyes, you've got four that mean eyes. Oplo with the L, opto, optico, and ophthalmo. Iris, we have iri, iro, irido, irito. Lens, we have phaco and phaco, one with the C and one with the K. Retina is retino. Lacrimal apparatus is dacrocysto and lacrimal. Ears, we have acousto, acousto, audio, audito, and oto. Outer ear is peni. Middle ear is myringo and tympano, and then the inner ear is labyrintho. So these are your new combining forms for the chapter. So the function of the eyes, these are receptor organs of sight. They receive images and transmit them to the brain. Structures, we have eyeball and annexa. You can see here the structures. This figure here is the structures of the eyes. Upper eyelid, lower eyelid, conjunctiva, iris, pupil, sclera. Here's your eyelashes, the outer and the inner canthus, and then your upper eyelid here. So next of the eyes, the structures outside the eyeball, we've got the orbit, eye muscles, eyelids, eyelashes, conjunctiva, and the lacrimal apparatus. The orbit is also known as the eye socket. It's the bony cavity of the skull that contains and protects the eyeball and associated muscles, blood vessels, and nerves. You can see here the muscles of the eye. There's 6 major eye muscles. We have the superior, inferior, oblique, superior and inferior rectus, and then the lateral rectus, which is right here. Muscles of the eye, like I said, there's 6 major eye muscles. There's 3 pairs: superior inferior, oblique, superior inferior rectus, and lateral medial rectus muscles. They do allow for a wide range of precise eye movements. Binocular vision, looking at this term, we can break it down. Bin is 2, OCUL is eye, so it's a coordination of eye muscles allowing for depth perception. And then depth perception, the meaning of that is just the ability to see things in 3 dimensions. Let's take a look. So the eyelids, eyebrows, and eyelashes provide protection from foreign matter, excessive light, and injuries. Canthus, that is the angle where upper and lower eyelids meet. Canth is the corner of the eye. Cilia is just a small hair making up eyebrows and eyelashes. We have the tarsus. Tarsus is the edge of the eyelid. So it's just a framework within upper and lower eyelids. This provides necessary stiffness and shape. Here you can see the structure of the eyeball shown in cross section. So here's your retina. Here's your retinal arteries and veins, here and here. The optic nerve, choroid, sclera. Here's your lens, cornea. This is your path of light that goes right through. Pupil, iris, conjunctiva, sensory ligament is right here, and then the ciliary body and muscle is right here, the red here. So the conjunctiva, these are transparent mucous membranes lining underside of the eyelid. This protects an exposed surface of the eyeball. The lacrimal apparatus, these are structures producing, storing, and removing tears. So we have the lacrimal glands and the lacrimal fluid. We have the lacrimal canal, lacrimal sac, and the lacrimal duct. Eyeball is 1-inch sphere with only about 1/6 of its surface visible. As you can see, the ocular, looking at that term, is pertaining to the eye. Extraocular is outside, and then intraocular is within the eyeball. So here's the walls of the eyeball. They're made up of the sclera, choroid, and retina. So you can see here sclera, choroid, and then here's your retina, the posterior segment, and then the anterior segment. So we do have the 3 layers. Like I said, we have the sclera, which is the white of the eye. Choroid, this provides blood supply to the entire eye. And the retina is the innermost layer. This lines the posterior segment of the eye. And you can see the anterior segment of the eyeball. The anterior is here, which is the front, and then the posterior, which is the back. So the anterior segment then is front 1/3 of the eyeball. It's located behind the cornea in the front of the iris. Posterior then obviously is located behind the iris and in front of the ligaments holding the lens in place. This is the remaining 2/3 of the eyeball. We have rods and cones. They receive images that have passed through lens. Images convert into nerve impulses and transmit to brain via optic nerve. So the rods are the black and white receptors, and the cones are your color receptors. We have the macula, the light-sensitive area in the center of the retina. And we have the fovea centralis. This is the pit in the middle of the macula. We have optic disc. This is where the nerve endings of the retina enter optic nerve. This is also known as a blind spot. It contains no rods or cones. And then we have the optic nerve. This is where it transmits nerve impulses from the retina to the brain. We have the uvea. This is the pigmented layer of the eye. It's rich blood supply. This does consist of the choroid, ciliary body, and iris. So the ciliary body is a set of muscles and suspensory ligaments that adjust thickness of the lens and refine the focus of light rays on the retina. To focus on nearby objects, muscles adjust the lens to make it thicker. To focus on distant objects, muscles stretch lens to make it thinner. We have the iris. This is a colorful circular structure surrounding the pupil. Muscles contract, allowing smaller opening to decrease the amount of light entering the eye, and then muscles relax, allowing larger opening to increase the amount of light entering the eye. So these muscles control the amount of light entering through the pupil. We have the cornea, pupil, and lens. So the cornea is the transparent outer surface of the eye. This is covering iris and pupil. This focuses light rays entering the eye, and then the pupil is just that black circular opening in the center of the iris. And this permits light to enter the eye. The lens then focuses imaging on the retina. It's a clear, flexible, curved structure contained within clear capsule located behind the iris and pupil. Normal action of eyes, we have accommodation. This is where your eye adjustment for the vision at varying distances. We have convergence. This allows maintenance of single binocular vision as object comes nearer. Next we have ametropia. This is normal vision. Refraction, bending of light rays to focus on retina. And then the visual acuity is ability to distinguish object details and shape at a distance. Let's take a couple, let's take a look at a couple slides here. These are medical specialists related to the eyes. Ophthalmologist, this is a specialist in diagnosing and treating diseases, disorders of the eyes. Ophthalm is the eye, means eye. Optometrist, opto is vision, so it provides diagnosis of eye diseases, measuring accuracy of vision, determining need for corrective lenses, optometrist. Optician then is a healthcare practitioner who designs, fits, and dispenses lenses for vision correction, optician. Pathology of eyes and vision. The eyelids, we have ptosis, which is drooping or sagging of the upper eyelid. We have calzione. This is a nodule or cyst related to obstruction in sebaceous gland. And then we have blepharitis, breaking that term down. Itis is inflammation, and blepharos eyelid. So it's inflammation of the eyelid. And here you can see the disorders of the eye. The first one here, picture A here, is ectropion. Ectropion is turning outward of the edge of the eyelid. Where B here is entropion. It's turning inward the edge of the eyelid. So you can see the outer and then turning inward in that one. And we just went through both of those. And the other one that we have is hordeolum. Hordeolum is a pus-filled lesion on the eyelid. This is due to infection in the sebaceous gland. The next one we have is periorbital edema. Peri means around, orbit is eyeball, so it's just swelling of tissue around the eyes or surrounding the eyes. And this usually is associated with allergic reaction, is where you'd have that swelling. Additional annexia pathology. Let's take a look at some of these medical terms, a couple here. Conjunctivitis. Conjunctivitis is inflammation of the conjunctiva, usually due to infection or allergy. Itis is inflammation. And conjunctiva is conjunctiva, also known as pink eye. Then we have dacroadenitis. Dacro is tear. So this would be inflammation of lacrimal gland, and this is due to bacterial, viral, or fungal infection, due to a fungal infection. We have subconjunctival hemorrhage. It's bleeding between the conjunctiva and sclera. It's usually due to an injury. And then we have xerophthalmia. Zero is dry, so it's dry eye. This is due to decreased production of tears by tear glands. This may be related to aging, vitamin A deficiency, or systemic diseases. You have uveitis, inflammation of uvea. Iritis is it's an inflammation of the iris. And then we have corneal abrasion, injury to the outer layers of the eye. Cornea, C-O-R-N-E is cornea. Corneal ulcer, it's just a pitting of cornea due to infection or injury. And then we have diabetic retinopathy. This is a damage to retina as complication of uncontrolled diabetes is where you would see that diagnosis. Keratitis is inflammation of the cornea. Keratoconus. This is irregular cone-shaped cornea leading to distortion of vision. Scleritis is inflammation of the sclera. Sclera is white of the eye. So itis is inflammation. So inflammation of the white of the eye. May be associated with infections, chemical injuries, or autoimmune diseases. Next we have anisocoria. It's unequal sides of pupils, what that means. Aniso is unequal, cor is pupil. Cataract is a loss of transparency of lens, causing progressive loss of visual clarity. We have floaters. These are particles of cellular debris in the vitreous humor casting shadows on the retina. May be an indication of a retinal detachment. And then we have photopsia. It's appearance of flashes of light. So phot is light, opsia is view of. Meiosis, myo is smaller. The contraction of pupil in response to light may be due to prescription or illegal drugs. Mydriasis, this is dilation of the pupil. Again, this may be due to diseases, trauma, or drugs. Nystagmus is the involuntary constant rhythmic movement of the eyeball. We have papilledema. This is swelling inflammation of the optic nerve. And this is at the point of entrance into the eye through the optic disc. And here you can see that where retinal detachment here, a hole in the retina would be your retinal detachment. So you have the sclera, the choroid, and the retina right here. So when that detaches, this is what this looks like. You have a hole right in the retina. So what a retinal detachment is, just separation of some or all of the retina from the choroid. The lack of treatment, if a person doesn't get it treated, could lead to blindness. Next, we have retinitis pigmentosa. This is a progressive degeneration of retina affecting night and peripheral vision. This appears as dark pigmented spots on the retina. Next, we have glaucoma. So glaucoma is a group of diseases characterized by increased intraocular pressure. This results in damage to the retinal nerve fibers and optic nerves. So we have open angle glaucoma. This is more common form, detected through regular eye examinations. And then we have closed angle glaucoma. This is narrowing of area between the cornea and iris. Results in decreased fluid to the trabecular meshwork. This is sudden pain, nausea, redness of eye, and blurred vision. Again, lack of treatment leads to blindness in as little as 2 days. Closed angle glaucoma. Macular degeneration. What this is a progressive condition causing damage to the macula. So again, it results in loss of central vision, macular spot. There's different types. We have age-related, dry macular, and wet macular. Let's take a look at some of these terms. These are functional defects. We have diplopia. What this means is perception of 2 images of a single object. Next, we have hemianopia, blindness in one half of the visual field. Hemi is half. And then we have monochromatism. Mono is one, chromat is color, so it's inability to distinguish certain colors. Nyctalopia, difficulty seen at night. Photophobia, photo is light, so it's excessive sensitivity to light. Presbyopia. Presby is old age, so it's a decline of near vision related to aging. Strabismus is improper eye alignment due to the ability of eye muscles to coordinate. We have isotropia. Isos inward, trop is turn, so it's an inward deviation of one or both eyes. And we have exotropia. It's the outward deviation of one or both eyes. Exo would be the outward. Iso then is your inward. Refractory disorders. First one we have is emmetropia. Images do not focus properly on the retina. So this included astigmatism, hyperopia, and myopia. AMETR is out of proportion. Astigmatism is a lack of focus due to uneven curvature of the cornea. You have hyperopia. This would be your farsightedness, and myopia is nearsightedness. Blindness, which blindness just means the ability to see. We have legal blindness, best corrected vision of 20/200. Amblyopia, dimness of vision without any detectable disease of the eyes. Ambly is dim or dull. And then we have scotomia, abnormal area of diminished vision surrounded by area of normal vision is what that means. Let's take a look at some diagnostic procedures for vision and eyes. With a Snellen chart, this measures visual acuity. We have refraction. It determines refractive error. Also determines corrective lens prescriptions. We have diopter is unit of measurement of lens refractory power. We have the cover test. This assesses binocular vision. And then we have visual field testing, determines loss in peripheral vision. Next, we have diagnostic procedures of the eye. Ophthalmoscopy, use of ophthalmoscope to visually examine fundus of the eye. Dilation is just an artificial enlargement of pupil to examine the interior of the eyes. Mydriatic drugs, this forces eyes to remain dilated in the presence of bright light. Continue, we have the slit lamp ophthalmoscopy. This is focusing the beam of light onto parts of the eye. And then we have fluorescein staining, application of fluorescent dye to the surface of the eye by eye drops. This does cause corneal abrasion to appear bright green when they put this fluorescein staining in. We have fluorescein angiography. This is a radiographic study of blood vessels. This is in the retina after injecting a fluorescein dye. We have PERLA, P-E-R-R-L-A. Pupils are equal, round, responsive to light and accommodation. This is a diagnostic observation. And abnormality could indicate head injury or brain damage. We have tonometry, a measurement of intraocular pressure. Tonal is tension. Treatment of procedures of eyes and vision. We have orbit and eyelids. Orbitotomy, surgical incision of the orbit for biopsy, abscess drainage, or removal of tumor foreign object. And then we have tarsorrhaphy. Tarso is eyelid, so partial or complete suturing of upper and lower eyelids. Next, we have conjunctiva eyeball. You can have the corneal transplant, enucleation, it's just removal of the eyeball. Ocular prosthesis, artificial eye fitting over replacing a malformed eye. We can have iridectomy, surgical removal of a portion of the iris, and the radial keratomy is surgical treatment of myopia. This is to bring focal point close to the retina, improving distance vision. We have the scleral buckle. This is repairing the detached retina, and then we have the vitrectomy. This is removal of the vitreous humor and replacement with clear solution. Cataract surgery, you could have a lensectomy. This is just surgical removal of the cataract clouded lens. You could have a phacoemulsification. That's an ultrasonic vibration to shatter and remove lens clouded by cataract. Or you could have the intraocular lens. This is where the surgically implant replacement of natural lens. Corrective lenses. These are just correct refractory errors. You could have concave lenses. These are used for myopia. convex lenses used for hyperopia. May have 2 refractive powers bifocal and 3 refractive powers trifocal. Also, they would be contact lenses. So they're disposable soft lenses that cover the entire cornea. Laser treatments of the eyes. We have the laser iridotomy. Focused light beam is used to create a hole in the iris. They do use this as a treatment for closed angle glaucoma. We have the laser trabeculoplasty. Let me see if I can say it. Trabeculoplasty. Trabeculoplasty. It creates opening in the trabecular meshwork, allowing proper drainage of fluid. Continue with the laser treatments. Next one would be LASIK, and everybody's probably familiar with this one. This treats vision conditions caused by the shape of the cornea. And then we have the photocoagulation. This is use of laser to treat some forms of wet macular degeneration. Or it can also to repair small retinal tears. They could use this treatment. Then we have the retinopexy, reattaches the retinal detachment. Okay, moving on, that was the eye. Now moving on to the ear. Let's take a look at these. So the function of the ear is just a receptor organ for hearing. We receive sound impulses and transmit them to the brain. The inner ear helps with maintain balance, with auditory pertaining to sense of hearing, and then acoustic pertaining to the sound of hearing. Here are the structures of the ear. You kind of see the inner ear, middle ear, and then the outer ear with all of them labeled there. We'll go through each one of these. So there is 3 separate regions with the outer, middle, inner. We have the pinna, which is also known as auricle. It's the external portion of the ear. This is where it captures sound waves and transmits them into external auditory canal. We have the external auditory canal, transmits sound waves to tympanic membrane of the middle ear. Serum is just the earwax, secreted by seminous glands lining auditory canal. Excuse me. It's a protective substance that traps small insects, dust, debris, and bacteria. The middle ear then transmits sound across space between outer ear and inner ear. We have the tympanic membrane, also known as the eardrum. It's located between the outer and middle ear. The membrane transmits sound by vibrating. Looking at this, myringo and tympano both mean tympanic membrane. So these are combining forms for both combining forms that mean tympanic membrane. We have the mastoid process. This is a temporary bone-containing hollow ear, space around the middle ear. We have the auditory ossicles. They transmit sound waves from the eardrum to the inner ear by vibration. The malleus, the incus, and the stapes. We have the eustachian tubes. These lead from the middle ear to the nasal cavity and throat. They equalize air pressure within that middle ear with that of the outside atmosphere. We have the inner ear, contains sensory receptors for hearing and balance. Oval window then is located under the base of the stapes. The membrane separating the middle ear from the inner ear, and this allows entrance of vibrations into the inner ear. We have a cochlea. It's a snail-shaped structure. This is where your sound vibrations are converted into nerve impulses. Then we have the organ of corti. This relays vibrations to auditory nerve fibers. This transmits sound to auditory center of the cerebral cortex for interpretation. We have the semicircular canals. There are 3. Contain endolymph and sensitive hair cells that bend in response to the movements of the head. And this does also assist with equilibrium. Acoustic nerves, they transmit information to the brain. There's 2 parts. The cochlear nerves transmit sound for hearing, and then the vestibular nerves sense balance and head position. Normal action of the ears, we have air conduction. And what this is the process of sound waves entering the ear through the pinna and traveling down the external auditory canal to strike tympanic membrane. And then we have the bone conduction. This occurs as eardrum vibrates, causes auditory ossicles to vibrate. We have the sensorineural conduction. This occurs when sound vibrations reach inner ear. Let's take a look at some medical specialists related to ears. We have the audiologist. Audi is hearing. So this is a specialist in measuring of hearing function and in the rehab of persons with hearing impairments. We have a speech language pathologist. These medical specialists assist patients with problems related to swallowing, speech, and communication disorders. The pathology of ears and hearing: we have the outer ear, impacted cerumen. It's accumulation of earwax. This is a forming solid mass and adhering to the walls of the external auditory canal. Looking at a couple medical terms we have otalgia. Ot is ear, algia is pain, so just pain in the ear. Otitis is inflammation of the ear. Itis is inflammation. Ot is ear. Otomycosis, myco is fungus, so this is a fungal infection of the external auditory canal. Otopyorrhea, this is flow of pus from the ear. Pyo is your pus. Otorrhea, any discharge from their ear. Otorrhagia is bleeding from the ear. Some more medical terms that you have. Barotrauma, this is the pressure-related ear condition caused by pressure changes. Then we have cholesterol-toma, epidural cyst in the middle ear, and/or mastoid process made of epithelial cells and cholesterol. Mastoiditis is inflammation of the part of the mastoid bone. Itis is inflammation. Infectious. Myringitis is contagious inflammation causing blisters on the eardrum. And then otitis media is your inflammation of the middle ear. We have otoscleros. It's ankylosis of bones in the middle ear. It does result in conductive hearing loss. And your treatment for this, if your person would have otosclerosis, is a stampedectomy. The inner ear then, labyrinthitis is your medical term, inflammation of the labyrinth. Vertigo is sense of dizziness and loss of balance. We have benign paroxysmal positional vertigo, also that falls under this category. We have Meniere's disease. Tinnitus is your ringing, buzzing, or roaring sound in one or both ears. We have hearing loss. Acoustic neuroma, this would be a brain tumor adjacent to the cranial nerve. Deafness. Presbycusis, this is related to hearing loss and aging. Conductive hearing loss, and then the sensorineural hearing loss. This is due to damage of auditory nerve or hair cells in the inner ear, is where you see that hearing loss. Diagnostic procedures of ears and hearing. Audiological evaluation, obviously you're going to be evaluated for the measurement ability to hear and understand speech sounds based on pitch and loudness. We have the audiometry, use of audiometer to measure hearing acuity. Otoscope, instrument used to examine internal ear. Monaural testing involves one ear, mono is one. Binaural testing involves two ears. Some more terms that we have is tympanometry, use of air pressure and air canal for testing disorders of middle ear. Acoustic reflectometry, these are tests for sound reflection. This is from the eardrum, and this determines the amount of fluid in the middle ear. We have the Weber and Rin tests, use of turning fork to distinguish between conductive and sensorineural hearing losses. Next, we have the autoplasties, just surgical repair of the ear. Middle ear, this are your ear tubes. It's ventilating tubes inserted into the eardrum. This is to provide drainage for fluid and relief of pressure. We have mastoidectomy, surgical removal of mastoid cells. We have the myringotomy, surgical incision of the eardrum. That is just to relieve pressure. And then we have a stampedectomy. This is where the surgical removal of the top of the portion of the stapes. Ectomy would be surgical removal. Stapes would be your stapes. Tympanoplasty, surgical correction of the damaged middle ear. And then inner ear, we have labyrinthectomy. Ectomy again is surgical removal. And that would be all or portion of the labyrinth. Then we have the vestibular rehab therapy. This would be physical therapy to treat a variety of balance disorders. So treatments for hearing loss, we have assistive listening devices a person could get, cochlear implant, and fenestration. This is a new opening in the lab to restore hearing. Also, you get hearing aids. They have a different, this is just electronic device worn to correct hearing loss. Analog hearing aid. This is where they use a microphone to detect and amplify sounds. Then they have the digital hearing aid. It's the computer chip converts incoming sound to the code that is filtered before being amplified. And that is it for the chapter. Please go to the workbook and complete the rest of the exercises that are there. And thank you for listening.